Okay, so let's finish social and environmental influences on children. I made this a second video just so that they're a little shorter and easier to manage when you're watching them. So briefly, I want to touch just on violence in children and not only what we think of as child abuse, and I did do a separate voiceover for that, which you can find on Canvas, but more specifically, the effects of children observing violence or living in environments where there are violence. So there are long-term effects that children experience, not only with the physical abuse, but also living in environments, as I said, where violence, gangs, bullying, terrorism, those types of things exist. And what we know is that long-term, what the effects we see in the mental health of children over time, let alone the stress impact and the traumatic stress impact that children experience, can also lead to the physical complications that they get later on. What we need our patients and their families and caregivers to understand is that young children do not have the capacity cognitively to really make sense or bring order to some experiences that they may see on TV, that they may see in some of the video games that children have, that they may see online and a lot of the social media platforms. And too often today we've got kids that are running amok, if you will, able to access all of these channels and games and playing games of high violence, or just being aware of what's on TV. And it can have a real impact on children's mental health, as well as how they view the world and interact with those around them. So we need to be really cognizant and aware of that and help parents understand. I've been thinking a lot about that lately in terms of where we're at with what's going on in the world right now and how children are hearing and overhearing our discussions as adults, our concerns and our worries and our anxiety. Children pick up on that. And in fact, much of how they see the world is sort of an extension of how we as adults see the world. So it's very important that we don't address those things till we're ready to address them and have things a little more sorted out, and really be very, very careful what children see, what they overhear, and what they hear us discussing or watching to limit these effects on children. So some things we can think about, obviously, for the physical types of things, keeping the environment around the children safe. Firearms safety, chemicals, exposure to gun violence, etc. But also really paying attention to the media, social media platforms. We talk about putting locks on some of we can do that on TVs for viewing purposes. We can do that on computers, social media platforms. And we really need to encourage parents. I think we're going to see more and more that trickle-down effect of what children are exposed to. And what we need to do to really address the types of things they still, as I said, do not have the mental capacity to be able to make sense of or put some sort of logical thought on. So lastly, I want to look at some environmental influences, some things that children interact with in the environment around them or are exposed to in the environment around them, which can have an impact on growth and development and overall health. So first of all, poisoning. It goes without saying that poisoning is actually something that in the pediatric world we deal with, sadly, pretty frequently. Children ingesting things usually between the ages of 1 and 4, we most commonly note that. And you can see my listing there of the most common poisonings in the home. Amazingly, kids are still able to get into a lot of these products. Remember, they are climbers and explorers and curious little individuals. And depending on the age, they very much will mouth a lot of things as well. Those Tide Pods there were some of the things that came out in the media several years ago, people eating Tide Pods and challenges for Tide Pods. But additionally, medications that may be sitting around, children who are cared for by grandparents who may have medications around and in the area and maybe not secured because they're not used to that. We need to really talk about it and prepare families for that. Poison Control Center number. I always like to make sure all my patients, even if I'm discharging them from the hospital or a clinic, have the poison control numbers available by the phones everywhere or on cell phones. They really need to be available. We need to be able to respond quickly. So this is an example of a foreign object ingestion, and this little guy looks like it's either a coin or a nickel. Coins, as a matter of fact, are the most common things that children ingest. And we notice between the ages of about 6 months and 3 years, which again makes sense on what these kids are doing at this age, the exploring, the mouthing, and the manipulation of things. It's how they learn about the world around them. Yes, pins and safety pins are commonly swallowed. Lots of little toys, Legos being some of the most common that are ingested, especially those tiny pieces. So a lot of times when we're thinking about safety and we've got a 6 or 7-year-old who's playing with the 12-year-olds, or even just a 3 or 4-year-old playing with a 12-year-old's Legos, we have an ingestion risk. And we need to keep those things separate. And that's hard to do in families that have multiple children playing in the same spaces. So again, something to remind parents of. There's some amazing videos that you can find online. It's pretty crazy. Lead poisoning, I do want you to know, and I do want you to be familiar with. We do deal with this a lot in the city. And most oftenly what people think of when they think of lead poisoning is lead paint. And in old homes prior to the 1970s, when paint was made as lead-based paint, that does not exist anymore. However, there are homes out there that do still continue to have lead-based paint in them. Be aware, no lead level is safe in a child. And lead absorption is much greater in children. So they have the ability to kind of absorb it and retain it in their little bodies much more when you relate that to their body weight and size than we as adults do. So that is why it's such a concern in young children and why we see it so much more frequently. Additionally, to know that lead and high levels of lead can actually lead to cognitive concerns, cognitive delays, IQ changes, impaired growth and hearing is also often affected. So it's imperative that when we start to see some of these children falling off those growth curves, starting to have some complications in school, that we begin to address some of our concerns about the environment around them. The areas where we most often get lead paint today, if it's not in these homes, we have to remember that a lot of toys come from a lot of other countries where there are not regulations on the use of lead paint. And so some of toys coming in from some of those small foreign countries could definitely contain some lead paint, especially if children are mouthing those toys. Additionally, something that we often don't think about is the soil in and around our homes and in our neighborhoods. So if we've got a child who's living in an area where they're doing a lot of construction, maybe digging new areas for pipes, maybe old lead pipes, removing those, disturbing the soil around that, we actually couldn't be stirring up some lead availability in these kids. And if they're out playing and then their hands are in their mouths and all of those things, they definitely can be ingesting high levels of lead. So it's important that we look at not only paint in the home, but toys they're playing with and the environment around them. The way we treat it, we check their blood levels for lead poisoning. So by checking blood levels, we have the idea of whether there is any lead in the system or not. And then we follow those lead levels as we go through the process of chelation therapy. Chelation therapy is actually the process by which we remove lead from the child by giving them this medication that binds to the lead particles and then excretes it from the body. So it enables these lead particles to bind to an agent and more easily be excreted from the body. And then we follow up with lead levels to make sure these children lose their lead levels and go down as close to zero as we possibly can get. And the only way we test for lead in children is by blood testing. So quickly, some nursing interventions just to think about. When we are doing anticipatory teaching with all of our patients, we always have to be thinking about the social and environmental influences depending on the age of the child. So we need to be thinking about children moving around, putting things in their mouths, climbing, very curious and getting into things. Well, then we have to help the family establish safety in that environment in which the child is working and playing. For prevention strategies, as we start to get into that school age where they're going to start having peer pressure and exposure to things like e-cigarettes and smoking and drug use and over-the-counter abuse of drugs. Gun safety, making sure that parents know children can get into things and can easily hurt themselves or someone else. So at all points throughout the life cycle, we're paying attention in these children and adjusting the environment as needed to meet the needs. And in many cases, it falls on nurses to do a lot of that teaching and anticipatory guidance. Bullying, just be aware of this. I think a lot of us have had a lot of bullying programs, so we certainly understand. But as a school nurse, oftentimes we're involved or they're involved very much in identifying signs and symptoms that are indicative of bullying. So a lot of those signs of stress can be either that, as we said, acting out or very much withdrawing in the environment, being excessively emotional and tearful, having very high responses to things that usually don't require or normally wouldn't have an excessively exaggerated response. And really paying attention. I think the thing that we do need to pay attention to even more today, when I was young, bullying ended when you left school. And so there was never that constant barrage of bullying like we see today with social media platforms and being able to continue to receive bullying 24/7 on that reel. And I think that that has a significant impact on the mental health of our young people, and something that we have to definitely address and clue parents into. That is it. We will be addressing this particular slide in terms of a case study, and the following slide in terms of a case study. So we will do this in class. But that ends the information that you need for social and environmental influences on the growth and development of children.